Good afternoon, folks. Now, topic C is talking about CMS is warning states that it can rescind or reduce rural health transformation program funds if states change approved plans or fail to meet agreed milestones. Federal officials have already pushed back on some state proposals and told states we will take the money back. Please confirm details with trusted news sources or the CMS site before acting on this. The Centers for Medicare Medicaid Services CMS is enforcing strict conditions on 5-year 50 billion Rural Health Transformation or RHT program, including a clawback mechanism that lets CMS rescind existing awards or reduce future allocations if states don't follow their approved plans or meet performance goals. Example, Maine's plan to use funds to cover care for uninsured patients was rejected by CMS, and state officials were told to revise their proposals. CMS Administrator Mohammed Mehmet Oz has publicly warned states that funds can be taken back if they don't abide the by what they wrote. Why this matters. Accountability pressure. CMS is using clawbacks to steer state policy choices. And implementation priorities, not just to fund projects, timing and scale. The RHT program distributes 10 billion per fiscal year from 2026 to 2030. Zero early compliance and reporting affect both near-term and future funding. Context. The program was created as part of a broader federal legislation that also reduces Medicaid spending substantially. Critics say the RHT funding may not offset the larger cuts to rural health financing. Political implications for states and rural providers. Stick to Stick to approved commitments. Major devastations from the application, especially policy changes, risk delayed uh, disreimbursement or clawbacks. Document process and matrix. CMS will evaluate CMS will evaluate process on schedule. States should maintain clear, audible records tied to the milestones in their cooperative agreements. Coordinate with legislators and stockholders. Several states face internal pushbacks. Lawmakers, hospitals, associations that can force plan changes. Those changes can trigger federal scrutiny or delays. Timeline and next steps. Evaluation window. CMS begins evaluating process late late summer with 2027 allocations announced at the end of October. States should states should be ready to show early wins and compliance. Your if your state official or hospital leader prioritizes aligning statutory authority, state laws that permit spending, finalizing measurable milestones, and maintain open lines with CMS to negotiate allowable adjustments. Without jeopardizing funds. Bottom line, CMS is enforcing tight oversight and will use clawbacks to enforce compliance. States and providers should treat RHT awards as conditional. Conditional. Document everything and encourage engage CMS early to avoid losing funds. Quick take. CMS is enforcing strict conditions on the 5-year, $50 billion rural health transformation RHT program and has warned states it can rescind or reduce awards. A clawback threat meant to enforce the plans states submitted confirm details with trusted news source of the CMS website before acting. What the reporting says. Program size and structure. The RHT program totals $50 billion to be distributed over 5 years. Half is split equally among states, and the rest is allocated by formula and competitive scoring. clawback authority and enforcement. CMS officials, including Administrator Mehmet Oz, have publicly said the agency can and will take money back if states don't abide by what they wrote or fail to meet milestones. Examples of federal pushback. States such as Maine were told to revise proposals. For example, plans to use funds to cover care for uninsured patients were rejected, illustrating that CMS is actively reshaping approved state plans. Context and controversy. The fund was added to broader federal legislation that also reduces Medicaid spending. Critics worry the 50 billion won't offset larger Medicaid cuts, and that CMS's oversight could steer states towards specific policy choices. Why this matters for states and rural providers. Funds are conditional. Awards are tied to the applications and cooperative agreements states submitted. Significant uh, deviations can trigger recensions or reductions. Policy influence. CMS appears to be using approval and clawback authority to encourage particular delivery systems changes rather than simply backfilling operating losses. Timing and leverage. Early compliance and demonstrable process matter because the program's multi-year disbursements depend on meeting milestones and reporting requirements. Political steps and recommendations. Align plans to the approved application. Avoid major policy shifts that aren't explicitly allowed in the cooperative agreement. Document any requested changes and get CMS to sign off before implementing them. Build audible matrix, define measurable milestones, collect baseline data now, and keep clear records tied to each milestone. Engage stockholders early. Coordinate with state legislators, hospital associations, and rural providers so political or operational pushback doesn't force plan changes that could jeopardize funding. Use CMS channels proactively if a proposed adjustment is necessary. Negotiate with CMS staff to document approval and avoid unaltered changes that could trigger clawbacks. The federal government is treating RHT awards as conditional and is prepared to claw funds back to enforce compliance. States and providers should treat awards as contingent, document everything, and seek CMS approval for any substantive changes. Okay, guys, that is C for you. I'll be back on with D in a bit. For now, Gator Wellness, take care, folks.